This is the no BS guide to the most effective exercises for thoracic outlet syndrome. And not only am I going to give you a giant list of exercises to do, I'm also going to show you how they help your TOS, what they have in common, and how you can make the changes you need to these exercises. Adam here from TOStreatment.com. And these first set of exercises is designed to help create scapular retraction, which is when the scapula gets pulled closer towards the spine. Now the reason why you want to strengthen this, we'll say movement pattern, is because it's going to help you fight off any compression in the chest region. You see, besides the rhomboids and the medial traps, there's plenty of other muscles that also attach to the scapula. And when these muscles get tight, like the pec minor for example, then not only can it create your TOS pain, by the way, but it will also pull your scapula away from the spine, which is scapular protraction, the opposite of what we're trying to do here. So if you have thoracic outlet syndrome, then there's a good chance your pec minor is short and tight, which is pulling your scapula into protraction, making your upper back, like the rhomboids and the medial traps, weak, because they're now stretched out. And this is why you want to strengthen the muscles that create scapular retraction, because it's going to help fight off that protraction the pec minor is doing, which will then hopefully decompress your nerves and blood vessels. Now remember the different types of patterns for why we're doing this training, because a lot of them fall into very similar patterns here. So with that said, let's go over some different exercises for scapular retraction. And these first two exercises are very similar. The first one is going to be front pulls and the other one is going to be face pulls. Now the whole point of both of these exercises and all these exercises in general is to make sure that you are starting the movement, regardless of whichever one you're doing, by pulling the scapula inwards towards that spine. So when you are performing your front pulls, make sure the initial movement is actually coming from the scapula pulling towards the spine, and that is what pulls the arms out and stretches the band. Same thing for the face pull, right? When you are pulling up and creating that bicep, doing that face pull, very famous by Jeff Cavalier, Athlete X, by the way, then you can also start that initial movement by pulling that scapula towards that spine and then let everything else follow. Now on top of that, we can also do something like a reverse fly or a single arm reverse fly. These are pretty much the same thing as a front pull, except now the band is anchored. Or you can end up doing something like some rows, either on a bench or right next to it. Again, keeping that elbow out to the side with the emphasis on pulling the scapula towards the spine and then letting that initiate the movements and do all the work. Our focus here is not to strengthen the arm, but to strengthen the muscles between the scapula and the spine. Now we just talked about how too much protraction towards the front of the body can create thoracic outlet syndrome. But what if we took that idea and flipped it on its head? What if instead of trying to strengthen the scapular retractors, we actually try to strengthen the scapular protractors? And the reason why you're going to want to do this is because if you can strengthen the other muscles that create scapular protraction, like the serratus anterior for example, then that's going to help the pec minor from not doing so much work, and then it's going to be able to take off some of that load. Think of it like this, right? Pretend there's two workers whose task is to turn a giant knob every time a light blinks. But every time that light blinks, only one of those workers is doing any of the work while the other one is sitting on his ass. And I'm sure you know what I mean, right? Because that other lazy coworker you got to deal with, when they're not doing any of the work, you have to do all of it, which means you get burnt out and you get stressed more, which means you are more prone to injury. And you see, that's exactly what's happening right now to the pec minor. You see, there's a good chance your pec minor is most likely doing all the work when it comes to scapular protraction. And because of that, the serratus anterior is left there being weak and useless, meaning the pec minor is going to get shortened and tight and most likely end up creating something like your TOS. Oh, and by the way, this is known as synergistic dominance. When there's a group of muscles that can control the joints, but only one of them is doing the action, then that one is synergistically dominant compared to the rest. So in order to fix this, we have to bring that other worker in to help share the load. Now you may be asking, how do we strengthen the serratus anterior when the pec minor does the same exact action. And to do that, we're going to be taking a look at those muscles' actions. You see, the pec minor, not only does it create scapular protraction, but it also creates downward rotation, while the serratus anterior can create upward rotation. So we're going to take advantage of this small distinction in order to strengthen the serratus anterior and not the pec minor. And here's how we can do that. One of the first exercises you can do here is going to be a push-up plus with your arms slightly in front of you. The whole idea of this is to allow your scapula to get pulled as close as you can to the spine and have that be your starting position. Now from here, you're going to initiate pushing upward, trying to rotate upward, as well as push away from the body in order to pull that scapula away from the spine. So by doing a protraction and a little bit of an upward rotation, you're going to be able to target the serratus anterior a lot more than the pec minor. And of course, this isn't the only exercise you can do here. You can do a plank push-up plus where you're just on your elbows and again dropping down and then pushing straight out in order to engage that serratus anterior. Or if you want to use a weight like a kettlebell, then you can just lay on your back or on a bench and again do the same thing where you're just pressing straight up and again trying to create a little bit of an upward rotation. All right, now the next movement we need to strengthen is going to be scapular depression, and very similar to why we wanted to strengthen the retraction. When it comes to scapular depression, most of us are usually engaged too much with the elevation, thanks to having our posture going forward, thanks to having tight necks and a tight upper back. All those muscles, all that ends up getting short and tight, which can also end up creating your TOS or maybe even just TOS-like pain. So in order to fight all this off, we're going to be basically just trying to strengthen the lower traps by trying to pull the scapula down with resistance. One of the first exercises you can do here is going to be a scapular pull-up. All you're doing here basically is just getting to a pull-up position. But now instead of trying to use your lats and bending your elbows and all that, you're going to keep your arms nice and straight. And instead, you're just going to use your scapula to get pulled straight down and back. Try to create a little bit of retraction as well when you do this. That's also going to help engage those lower traps. You can also do something like a band press down. This is something I made up, so don't ask me how much it activates the lower traps. I just know that it is technically doing all the correct movements in order to engage the lower traps here, and you can feel a little bit, especially with a stronger band. But the whole idea is that you are basically letting the band pull you into a shrug position with it behind your back, which forces you into a retraction. And then you're just going to push it straight down, again, trying to pull the scapula down in order to pull everything else. And of course, you can also do something like an IYT, pretty much you're laying on a bench, and you're doing something similar to a reverse fly pretty much, but you're on a bench now. And the idea is, again, instead of trying to pull the scapula in, we're going to come up slightly at an angle, and then you're just going to pull that down a little bit now. You're trying to pull the scapula down and inward at the same time, and not just inward, I guess. All right, moving away from the scapula, the next movement pattern you're going to want to strengthen here is going to be shoulder external rotation. But again, the reason is pretty much the same thing here, except now it's a different joint basically. Because when you have something like thoracic outlet syndrome and even forward head posture, then all the muscles that create that internal rotation, like the pec minor, for example, and even the subscapularis, then all those muscles end up becoming shortened and tight. And this is why we're going to want to strengthen the external rotators of the shoulder. And with that said, there are basically two main muscles you're going to want to target here. It's going to be the posterior deltoids and the rotator cuff, the infraspinatus and teres minor. And during these exercises, I will show you how to basically change up the exercise a little bit in order to target one or the other. Now, the first exercise you're going to be doing here is going to be a banded external rotation. And pretty much the whole idea of this is to keep your elbows to your side, have the band with some tension in it, and then pull it away, trying to use the rear shoulders as the initiator when it comes to this movement. Now this right here, this exercise is mainly going to target the rear delt. But if you wanted to target the infraspinatus, the rotator cuff muscle, What you can do here is actually bring the elbows up in front of the body, which is going to put the rear delts on a stretch and now weaken them technically, which then allows the infraspinatus to do all the work. Just like how we kind of did a more of an upward rotation to target the serratus anterior instead of the pec minor, we're now bringing the elbows forward a little bit. We're creating a little bit of shoulder flexion to take the rear delt out of it and now target the infraspinatus. Now, on top of having a banded external rotators, you can also do something like an IYT again, except now when you come out, do some external rotation at the very end. This kind of helps you target everything at once. Or you can just use a band on top of a bench to do an isolated exercise, having it to the side if you want to target both muscles, the rear delts and infra, or have your arm up the front. Again, that's going to stretch out the rear delt, and that's going to allow you to target the infraspinatus a lot more. Now, there's one muscle I haven't taught yet that most people do mention when it comes to TOS, and that muscle is going to be the scalenes. And in order to counter that, most people are going to recommend something like chin tucks. But what if I told you there's a better way? You see, what most people don't realize is that your TOS and even bad posture is most likely created by tight fascial lines within the body and not your tight muscles. Except now it's a giant muscle with all of your smaller ones in it, and is actually pulling on your entire body from the head all the way down to the toes. This is why they're called fascial lines, because each of these giant lines can create tension all on their own, just like a muscle. So with that new knowledge, here are two fascial lines you have to know about. The first one is the superficial front line, and this fascial line pretty much runs from the top of the feet through the front of the body into the quads, through the cord, up into the neck, around to the top of the head. And then you have the opposite of that. You have the superficial back line, which starts off on the bottom of the feet, goes up through the calves, through the hamstrings, into the glutes, into the erectors, all the way up towards the top of the head. Now, most of you who have TOS and bad posture will most likely have a tighter superficial front line, meaning it is getting shortened thanks to overuse of it. And sadly, the tighter this fascial line gets, so does the muscles inside of them, like your neck muscles and your chest muscles. So to fight off that fascia pattern, one of the best movement patterns you can do is going to be spinal extension. And here are a few exercises to do that. One of the first exercises you can do to strengthen your spinal extension, the movement, is going to be Superman's, and this one's pretty easy to do. All you gotta do is start off by laying flat on the floor, face down, with your arms either behind your head, to the side, or in front of you. From here, you're gonna lift your body up, trying to contract your spine, your muscles around it, the erectors. Hold for a second and then slowly let yourself down. Or you could do something like a quadruped where you're on your knees and your hands and you're pretty much alternating opposite arm and opposite leg, holding for a second and then laying your turn. By doing this specific exercise, you are pretty much doing a plank with your erectors, right? You're strengthening them through movement of the limbs, which is going to help it get stronger when you're doing your daily tasks. And of course, you could do other exercises like good mornings, either with some weight or with a band, or you can do something like a deadlift to work on the entire posterior chain, the entire superficial back line. So now that you have this giant list of exercises and the reasons why you should be performing them, all you have to do now is put them together to create the perfect workout for your TOS. Let me know in the comment section how it goes.